Who is at high risk for breast cancer? Give yourself another day, another chance. You'll find your courage eventually. Don't give up on yourself yet. A risk factor is anything that increases your risk of developing breast cancer. Risk factors you can control. Weight. Being overweight is associated with increased risk of breast cancer, especially for women after menopause. Fat tissue in the body's main source of estrogen after menopause, when the ovaries stop producing the hormone. Having more fat tissue means having higher estrogen levels, which can increase breast cancer risk. Diet. Studies are looking at the relationship between diet and breast cancer risk and the risk of recurrence. More research is needed in this important area for women who are interested in eating well to reduce their risk of ever getting breast cancer. In the meantime, here's what dietitians suggest. Keep your body weight in a healthy range for your height and frame. Body mass index, though not a perfect measurement, can help you estimate your healthy weight. Eat plenty of vegetables and fruit, more than 5 cups a day. Try to limit your saturated fat intake to less than 10% of your total calories per day, and limit your fat intake to about 30 grams per day. Eat foods high in omega-3 fatty acids. Avoid trans fats, processed meats, and charred or smoked foods. Exercise. Evidence is growing that exercise can reduce breast cancer risk. The American Cancer Society recommends engaging in 45 to 60 minutes of physical exercise 5 or more days a week. Alcohol consumption. Studies have shown that breast cancer risk increases with the amount of alcohol a woman drinks. Alcohol can limit your liver's ability to control blood levels of the hormones estrogen, which in turn can increase risk. Smoking is associated with small increase in breast cancer risk. Exposure to estrogen, because the female hormone estrogen stimulates breast cell growth. Exposure to estrogen over long periods of time without any breaks can increase the risk of breast cancer. Recent oral contraceptive use, using oral contraceptives, birth control pills, appears to slightly increase a woman's risk for breast cancer, but only for a limited period of time. Women who stopped using oral contraceptives more than 10 years ago do not appear to have any increased breast cancer risk. Stress and anxiety. There is no clear proof that stress and anxiety can increase breast cancer risk. However, anything you can do to reduce your stress and to enhance your comfort, joy, and satisfaction can have a major effect on your quality of life. Risk factors you can't control. Gender, being a woman, is the most significant risk factor for developing breast cancer. Although men can get breast cancer too, women's breast cells are constantly changing and growing, mainly due to the activity of the female hormones estrogen and progesterone. Age. Simply growing older is the second biggest risk factor for breast cancer. From age 30 to 39, the risk is 1 in 228 or 0.44%, or just under 3.5% by the time you are in your 60s. Family history of breast cancer. If you have a first-degree relative, mother, daughter, sister, who has had breast cancer, or you have multiple relatives affected by breast or ovarian cancer, especially before they turned age 50, you could be at higher risk of getting breast cancer. Personal history of breast cancer. If you have already been diagnosed with breast cancer, your risk of developing it again, either in the same breast or other breast, is higher than if you never had the disease. Race. White women are slightly more likely to develop breast cancer than are black women. Asian, Hispanic, and Native American women have a lower risk of developing and dying from breast cancer. Radiation therapy to the chest. Having radiation therapy to the chest area as a child or young adult as treatment for another cancer significantly increased breast cancer risk. The increase in risk seems to be highest if the radiation was given while the breasts were still developing during the teen years. Breast cellular changes. Unusual changes in breast cells found during a breast biopsy, removal of suspicious tissue for examination under a microscope can be a risk factor for developing breast cancer. These changes include overgrowth of cells or abnormal appearance, hyperplasia, or atypical appearance. Exposure to estrogen, because the female hormone estrogen stimulates breast cell growth. Exposure to estrogen over long periods of time without any breaks can increase the risk of breast cancer. If you want to hear more updates, please subscribe to my channel and click the notification bell. Some of these risk factors are not under your control, such as starting menstruation, monthly periods at young age before age 12, going through menopause, and a monthly cycle at age after 55. Exposure to estrogens in the environment, such as hormones in meat or pesticides such as DDT, which produce estrogen-like substances when broken down by the body. Pregnancy and breastfeeding. Pregnancy and breastfeeding reduce the overall number of menstrual cycles in a woman's lifetime, and this appears to reduce future breast cancer risk. Women who have never had a full-term pregnancy or had their first full-term pregnancy after age 30 have an increased risk of breast cancer. For women who do have children, breastfeeding may slightly lower their breast cancer risk, especially if they continue breastfeeding for 1.5 to 2 years. For many women, however, breastfeeding for this long is neither possible nor practical. DES exposure. Women who took a medication called diethylstilbestrol, DES, used to prevent miscarriage from the 1940s to 1960s, have a slightly increased the risk of breast cancer. Women whose mothers took DES during pregnancy may have a higher risk of breast cancer as well. If you have a strong family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, you may have a high risk of getting breast cancer. You may also have a high risk for ovarian cancer. Having dense breasts have more connective tissue than fatty tissue, which can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are more likely to get breast cancer. What can I do to reduce my risk of breast cancer? Some women will get breast cancer even without any other risk factors that they know of. Having a risk factors does not mean you'll get the disease, and not all risk factors have the same effect. Most women have some risk factors, but most women do not get breast cancer. Many factors over the course of the lifetime can influence your breast cancer risk. You can change some factors such as getting older or your family history, but you can help lower the risk of breast cancer by taking care of your health. Keep a healthy weight. Exercise regularly. Don't drink alcohol or limit alcoholic drinks. If you are taking or have been told to take hormone replacement therapy, external icon, or oral contraceptive external icon, birth control pills, ask your doctor about the risk and find out if it is right for you. Breastfeed your children if possible. If you have a family history of breast cancer or inherited changes in your BRCA1 and BRCA2 genes, talk to your doctor about other ways to lower your risk. Staying healthy throughout your life will lower your risk of developing cancer and improve your chances of surviving cancer if it occurs. Research done by Dr. Ray J. Libakin. So please subscribe to my channel and click the notification bell for future updates. Thank you.